Hey, welcome to the channel and the podcast. This is the Recharge podcast. I'm also sharing this content, obviously, on the YouTube channel here. And it's November, so we're talking about men's health topics. Some of this familiar, some of it not, but I hope you gain some value. This is an educational series I put together, and I look forward to sharing with you. Take care. Be well. This is the Recharge podcast, episode 138, talking about breast cancer in men. Unveiling the silent truth is the topic. I bet you probably didn't think about men in terms of breast cancer. It's not super common, but I've had a few patients in my own clinical practice that have had breast cancer and undergone mastectomy, chemotherapy, and a variety of other modalities to deal with it. Fortunately, it remains rare, but it is something definitely to consider about. This year alone, about 2,700 men in the United States alone will find themselves embarking on a breast cancer journey. That number's been growing steadily by about 26% since the 1980s for a variety of proposed mechanisms. Here's what we know. The cancer journey starts subtly. Obviously, a small number of cells are abnormal, grows into a larger clump or lump, if you will. This can create some swelling beneath the nipple, could cause some skin changes, some other things that might be very subtle, maybe pain, maybe discharge, some things that men maybe aren't as in tune to as women because we haven't been ingrained or trained to really perform self-examinations on our breast tissue or our pectoralis chest area. And so the path of discovering and treating male breast cancer is obviously following in the footsteps of women's experience with the disease. The lack of awareness surrounding this is often a mechanism to ignore the issue at hand. This grows silently, unnoticed, until it reaches a stage where it's very hard to ignore. And because it's so rare, there isn't as much research in the men's health realm, leaving us with pages yet to be filled in this chapter of medical science. Men come with their own unique set of risk factors such as genetics, specific life experiences, medical histories, possibly undescended testicles, exposure to chest radiation, x-rays, scans, things of that nature. Knowing these can be the light that guides us through the fog of uncertainty, helping with the early detection and understanding of this condition. In terms of treatment, it's like reading a book from the female breast cancer journey. It can involve surgery, radiation, hormone therapy. These are all familiar characters in the story that's well known and has been played out in many homes around the world, unfortunately. Survival, though variable, carries the hope of triumph, and it underlies the spirit of resilience. With adequate screening and detection and early treatment, like many things in medicine, this can be readily addressed and handled up front. So let's broaden the horizons of our understanding. Let's break the silence. Let's bring light to the unspoken tales of men who've gone through their own breast cancer journey, because in the heart of awareness, there blooms a flower of hope and early detection, making the journey a little less daunting and filled with supportive footprints for those to come. If you're not familiar with some of the genetics behind breast cancer, there are a variety of markers. I participated in a study with 8 or 9 markers that are related to the way a particular person's body can process hormones, chemicals, estrogens, toxins, things of that nature. BRCA1 and BRCA2 are the most well-known, and I just wanted to just shed a little bit of light on those for those of you who are maybe not completely familiar with these. BRCA1 and BRCA2, or the breast cancer genes, they're genes that produce proteins that are responsible for suppressing the growth of tumors. These genes are often referred to as tumor suppressor genes, and it's the mutations that alter the genetic code that can increase the risk of developing certain types of cancer, particularly breast cancer in both men and women, and ovarian cancer in women as well. So I hope you found that helpful. As always, be safe, be well, and we'll talk to you soon.